Welcome to the office.
Welcome. How you doing?
Not bad.
What brings you here? Where are you coming from, first of all?
England.
From England?
Yeah.
All right, what part of England?
Newcastle.
Let's talk about top 3 issues that are going on in your body. I see an x-ray, but tell me what's going on.
Neck pain.
Neck pain?
So twistings, tight twistings, I turn left and right. But it all started when I lifted something and I pulled a muscle, well I felt it was pulled a muscle in my back.
You pulled a muscle when?
5 years maybe. And then...
And your muscle still pulled?
No, I had a deep tissue massage.
Okay.
I had one of them vertical hanging upside down.
The inversion tables?
Yeah. 2 days after that I collapsed at work. My head went really hot and I had dizzy spells, and luckily I managed to grab a hold of something and fell over.
Okay.
The doctors check for vertigo, that's all they check for.
Okay. Did they check, make sure there's nothing in the head?
No.
Any brain scans?
No.
Okay.
And then basically I just ploughed on, but it got to the point where I would, if I got up quickly and turn, I would be slightly off balance.
To the right or left?
More to the right, I think. Because I've now come to live with it in a sense over the last 5 years. It's just, that's when I get up, if I get up and I'm too quick, I just feel slightly uneven.
In your head, on your feet?
Just
whole body?
Yeah, just feel off balance, but not to the point where I'm falling over or anything. I'm just.
Okay.
It's hard to explain.
Your left eye.
Yeah, I'm ambliotic.
Okay.
So I was born with amblyopia.
Okay.
So I'm half blind in one eye. That's
left eye, right eye.
Left eye. So that's the cornea. The visual cortex doesn't work properly. So I had to be patched when I was a child. So I patched the good eye to make the right eye work properly. Unfortunately, it wasn't fun patching me on your eyes.
Can you see out of your left eye?
Yeah, but not. I can't. It's in England the division's 6 and 6. So if you do it here, 6 and 20 or whatever. 20.
Yeah.
I'm 6 and 6 in one eye, 6 and 36 in the other. That's the only way I can describe it.
Okay.
So I can actually close my eye, I can see you, but I couldn't read anything on you.
Okay.
I can visually see.
But if I come close to you, can you see it better?
No.
If I'm further away, you can see better.
I can, but I still can't I can't.
Visual acuity is not there.
I can't focus on words, but I can actually see my surroundings and everything.
Okay. So that's the neck.
Yeah.
All right. Number 2.
But obviously the lower back has always been, because of that twisted muscle, that always feels tight. It's been worse this last couple of weeks. Sometimes it goes really bad, depends on how much, because it's concrete floors where I work, so a lot of the time it's stepping on and off things, so that makes it worse. And then my knees sometimes it's clicking, and then the last week, because the back's been hurting, it's made my knee worse, and then the flight yesterday was just horrendous.
How long was the flight?
We were in planes for, I think it took us 26 hours in total.
Oh, wow.
And the last flight was 10.5 hours.
You had delays?
2.5 hours delayed on the flight, so we're sitting on the plane for 2.5 hours before even going anywhere.
Yeah.
So it's not been the most fun.
So you're here.
Yeah, I'm here.
And you're here now.
Yeah.
All right, so hopefully we're going to be able to get you some good relief today, get you moving, and get a nice meal tonight, and some nice rest, okay?
Yeah.
All right, so we have back, we have neck, we have knees, we got a lot of stuff.
Yeah.
Okay, we have digestion to talk about while you're here.
Right.
And you said you're here for a week.
Yes.
You've had a couple of things, sir. I'm going to show you on your x-ray, and whether you recall them or not, we have some old stuff as well. We're going to put it all together, but there's nothing specific you remember besides that one.
No. I remember I was knocked over by a car when I was 5, but I can't really remember that.
Okay, but that's also going to be significant. Yeah. On the lateral x-ray, the first thing we want to look at is your posture. And we can see a few things already just based on his posture. If I run this line, I'm running a posture line from the center of L5, and this line should go through the base of the neck, C7 and C2. And what we can see here is this: you kind of you need a little more curve in that low back here. Your mid back curve is okay, but what's happening here is he has anterior head carriage, forward head posture. And why that's important is this. So C2, 3, 4, 5, 6, 7. So this line should be here. It's just a little bit behind. But more important is that we have anterior head carriage. So we have almost a 20-degree forward head posture. And what the research shows, for every degree forward from neutral, it's like we carry an extra 10 pounds of weight in our lower cervical spine. So you carrying 200 pounds on the shoulders, on the neck. That's what you probably feel, right?
Yeah.
Okay. Now, the other thing is we have an old injury here. And we need to figure out what that is. We have an old injury right there. And that's at least 30 years old. Check it out. This is your C2. Look at that, C3.
I used to when I was younger. I don't know if it means.
Now the story goes.
Well, no, it wasn't an injury as such.
What
But
happened?
when I was younger, because there was a kid that was quite sort of
Mhm.
used to pick on people, sort of thing. He once got us in a headlock. He was pinning us down, so I tipped my neck, cracked it, slumped, and he thought he'd broke my neck and started running. So that was fine.
Oh,
But
wow.
after that, I realised that I could actually just self-adjust myself. So
Well, there's a couple of things here in the neck. We have C2, C3. You can see the disc is starting to wear out. The end plates are getting a little jaggedy. This thing is trying to fuse together. The other thing I see here is 2, 3, 4, 5. Number 6, you can see this is too close together. Now we're going to test it on the flexion. Remember, he had you go down and back, right?
Mhm.
So on flexion extension, let's see if there's another answer there. So yeah, you have no extension movement. Let's see what happens here. Well, same thing in flexion. So here's part of the answer of your neck. C6 didn't really open up in flexion, did it? So what I want you to see is this. Look, this is you going forward.
Yep.
This is your neutral.
Just did the same
Okay,
thing.
when you open, when you flex, those bumps in the back, the spinuses should fan and open up.
Yep.
And what I want you to see here is it doesn't, right? This is still closed. So we have a C3 and we have a C6 potential, 2 in the neck. They're a little close together.
Okay.
If I have to decide in lieu of, before even the exam, 6, we would normally work with the lower one, but we'll see what we find. So C6 is a potential, okay? So the thing that is apparent to me here is you did have trauma in your back. It is a little fuzzy in here, I do see. Your discs are good here. So this is your L4 disc, 3, 2 is a little bit less, but they're still decent. The thing is they're all tilting, and the question is why? Now we gotta zoom in here. Let's see if we can change the contrast and see anything different. I'm looking on this one. And what I see here is you actually did have an old sacrum, tailbone injury. You have a BP sacrum. Your sacrum is slightly posterior to your L5. So your foundation is actually off.
Right.
And that's what's throwing off the rest of it,
Yeah.
okay? So we have a tailbone issue. 5 is tilted, 4 is tilted, 3 is tilted, 2, 1, 12, 11, 10, all the way to 9. So 9 starts to level off. So everything from your low back L5 to right below your shoulder blades is all compensating.
Right.
That's not your issue. So 9 levels, the next one to go off is what? 8, 7. That's the sugar button. All right, so we have a potential at 7. We have the tailbone. We have C6 and we have C3 on the lateral x-ray. Now we're going to go to the A to P and let's take a look and see. All right. You've heard me talk a lot about foundation, right, sir?
Yeah.
There's your answer. See your left hip versus your right hip?
Yeah.
You're tilted pretty significant, and there's a lot of scar tissue in that low back. It's probably going to be a little spicy today, dude. Let's look at your foundation. All right, so what do we have going on here? We have a rotated sacrum on the right, 17 millimeters, drop 6 on the left. So that was an old tailbone injury. We have a measured difference of 19 millimeters right now. We have a dropped pelvis on the same side. If we're able to get your pelvis corrected, then we can get 19 to 13. But this has to be under 7 regardless.
Right.
If the foundation isn't level, neck's not going to get fixed. Okay, you already know all this. So we have a sacrum on the right, we have a PIX on the left. with the short leg on the left. So we're going to decide today, based on our exam, are we starting on the right sacrum or the left pelvis? Number one. Number two is going to be something in that mid back around T7, T8. Number three is going to be in the neck, C6 or C3. That's what I see. Questions?
No.
All right, you ready to get started?
Yep.
Let's do it, Brian. All right, you're going to walk to the corner of the room and back several times, starting now. Yeah, he got that side shift going on. Have you always walked with both feet out?
As far as I know.
All right, so he was dropped on his head as a kid. I'm just saying. Keep walking. All right, and is this his walk now? This is about how he walks? Okay, good. So you can see he tilts to that left side. You go down to that left when you walk. I want you to see his dimples. I want you to watch this here, okay?
Okay.
When he walks, this left side, it goes to the side and goes down. Walk, please. Yeah. So he really swings his left leg. He doesn't really step on his left leg. Keep going one more time, please. I'm going to repeat that. He swings his right leg, not his left leg. Because the left leg is short, he steps on the left and he swings that right around. Starting at the base of the neck. First thing we're getting is 15 points, C6. C6, 15 points. 3 points, C3. So the bigger the number, the more inflammation or the more heat variability there is, differential there is. 10 points. T7. Right, that's 6 points. T6, T7, 10, there it is. Down in the basement, S3. S3, S2, S3, T6, T7, C6, and C3. Those are the major pressure readings I find. Let's go ahead and do static palpation now. Static palpation, running the fingers down the spine, down the spinuses, along the sides. And you can already see dishing in his spine. And we talked about dishing in the past, and I just want to briefly talk about dishing. What I mean by dishing, and I'm not talking about the X-ray finding dish, diffuse idiopathic skeletal hyperexostosis. That's not what I'm talking about. I'm talking about the flattening or the curving of the upper thoracic spine. That usually starts around T7, T6, usually T7 or T8. And he does have something there, and it's causing a lot of this dishing here. It's flat. We want to have a little more curve in here if possible, okay? Now, as we run the fingers, you can see right here is where that swelling and edema starts. And it pulls right there. Right there. 1, 2, 3, 4, 5, 6. Now, more tender at 7 or 8. Any tender or finger pressure?
Just finger pressure.
Finger pressure. And I'm sure you also have a high pain threshold.
I probably do.
Okay. Yeah. 1, 2, 3, 4, 5, 6. So in his case, I have to go off most of my objective findings, and he may or may not feel the sharp pain, and I'm okay with that regardless. Okay, I have enough other findings to look at. Bring your head back and down. Arms across your shoulders, please. Raise your elbows up. Back and down. Back and down. Back. That's 6. That moves. That one right there. 1, 2, 3, 4, 5, 6, 7, 8. We're gonna wait on that mid-back because 8 looked like a compensation on the x-ray, okay? So it could be that the compensation was there a long time, became a subluxation, or it could just be that the ligaments and everything is just guarding for the compensation. Okay, hands down, please. Let's take a look at that back. Feet together. Open and close the knees with your feet touching, sir. Open and close. Open wide and close. Open and close. Left side only, please. So when he does the left, the whole right wants to shift. Right side only. Left is actually decent. It's actually moving okay. Now, this is number 5, sir. Tender.
Yeah, that's tender.
That's 5.
That's still tender.
That's 1.
That's probably more tender than the 1.
That's 2.
Yeah.
That's 3.
Yeah.
Right there.
Yeah.
That's 3. Not 4.
No.
Starts at 3. S3. T7, 8 maybe. Sit back for me, sir. Base of the neck, 7. 7. That's 6. That thing's not moving. 5, 4, 3. Your breathing is also off a bit, yeah? 3 or 6.
I never really noticed any difference there.
Okay. We're going to do divorce test. Turn left, turn right. So there's more movement if you look straight. Turn left, turn right. Less movement there. Look up, we're isolating the lower cervical. Left and right. Head down. Upper cervical. Left and right. I'm gonna go with 6, okay? C6 and S3 is where I'm gonna start. After that, I'll have you walk and then we're gonna recheck about that 7, 8 area. You ready? Showtime. Let's do it. C6, PLS, we're down on the left. Chin down, sir. Good. Let me have it. I'm just finding your sweet spot. There it is. Good. Drop it down. That's a piece. He's gonna make me work. Oh, he's gonna make me work for it. That's a little tiny piece. Come over here, please. We're gonna do a C6 knife edge contact. Just like that. There you go. Gotcha. You okay there, Buzz?
Mm-hmm.
Now the sacrum. So S3, and we want to get a slight torque. Ooh. We want to lift that left side up, okay? So slightly on the right and torque. Lift that chin. And that's
About that.
That's the home run, baby. Very nice. Step back, sir. Let's walk it out.
I thought that one go.
You're gonna walk a few times back and forth, please. As you're walking, you can tell me if anything is different.
It doesn't feel different. But you better tell me that.
Have a seat back over here. Let's continue. Six is clear. Neck is clear. This one shifted also. Let's see where it went. Yeah, that's there. We're going to need to do that one still. Sacrum is clear, neck is clear, T78 is still there. Before I do that, let's feel that low back. You remember what it felt like? Check it out. That's 5.
Yeah.
Different?
It is a lot, yeah.
That's
it still
1.
feels tight, but it's not. There's not really any.
Not as
pain.
sharp?
No.
3, 4. Dude, that's moving. A little tight in there, but it's moving. Okay, let's go back and do that mid-back now. This is T9. This is almost like he had an old rib fracture. This thing is healing. So T8 is the one we're gonna do right here, okay? An old rib fracture?
No, not that I know of.
Something at your T8 rib on the right.
Nothing that I've ever
Look.
known. Yeah.
Look. You see that?
Right.
You can see it better here. It
I
ain't
can see
nowhere
that
else.
little, like a finger.
Yeah.
Yeah.
And it looks like there was some old fracture that healed up. Very stiff in
Not that
the.
I can remember.
Okay.
No.
Well, I mean, I don't know what you've been doing your whole life, so I don't even know if you can remember certain things,
Yeah.
sir. Come on over. There you go. Gotcha. A little more. There. Walk it out. Okay, one test I'd like you to do is, can you just sit on the floor, please?
Yeah.
Just sit on the floor. And the first test is standing up, and let me know, it should be a little easier to stand up.
Yeah, a lot easier to stand on. Yeah.
Okay, that's number 1.
Yeah.
Have a seat over here. Turn your head to the left, turn to the right. Turn left, turn right. Okay, look up, turn left, turn right. I'm gonna go a little more, okay? There's a lot of scar tissue in there. Okay, good. Next thing I want to do is we're going to try something out. This is something new. I don't think I've ever shown this. All right, so what we're going to do right now is I just want to test your arms out. And what I'm doing is I'm determining if a heel lift is indicated or not for you, okay? Raise your right hand out. Push up as hard as you can. Left side. Push up. Which one was weaker?
That one.
Right side, okay. So we have a 19 millimeter deficiency on the left side, but we have a weak right. Okay, stand up for me, please. And I'd like you to, your heel should be on the back there. Okay. Actually, step off. Let's do a standing test. Raise this up. Don't let me push down. Good. Other side. Don't let me push down.
So that feels like going right.
Okay, go ahead and step on that, please. Make sure your heel is on there. Raise your left arm. Push up. Right side. Push up. A little better.
A little bit.
Okay. Step off. Step on that. Actually felt stronger to me. Right hand up. Don't let me push down. Better?
Yep.
More better?
I would say more better.
Step away for a second. Step on that. Raise your right arm. Don't let me push down. Not as good.
No.
Step away. Alrighty. So we have 7 and 5, 12. Stop checking on my butt, Shasha. I just play. Alright, right hand up. Don't let me push. Stronger.
Yeah.
Okay, last one. This is actually a really cool test. So 1 is looking at the x-ray for a heel lift indication. 2 is a functional test. Right hand up. Don't let me push down. Not as good. Step away. So the answer for you, my friend, is this. Let's do this last time. That is your answer. We need to get to that. Raise the right arm. Don't let me push down. That seems the strongest to me.
Yeah.
Do you agree?
I agree.
Have a seat, please. So what I just tested was what he's going to need. We need to get to using a 10 millimeter, 7 and a 3 heel lift. You will need a lift.
Right.
Okay. 7, and you're at 19. So 7 and 19 is what? 7 from 19 is 12. If we can correct 5 millimeters of it, we're good. And even if we can't, this is how much you need. All right? That's a new one, Shasha. All right, let's continue. Make sure there's no fluke here. Neck is clear. Mid back is clear. A little heat, but I'm okay. Sit up straight. And low back is clear. And L5, S1, a little less, yep.
Mm-hmm.
Let's do the ears now. Let's tune up the other stuff. Ears, shoulders. Let me do the work, sir. Drop it down. There you go. Let me do the work. There you go. Raise your right leg. You want your nose job today too?
If you want.
It's not if I want, it's if you want.
You can't do.
AS talus, AS talus. There you go. Now, let's take a look at the nose. Let me put on my gloves for him. He snores, right?
Yeah.
Oh, yes.
You're gonna tell me this week what changes, okay, in his snoring. And the thing about the nose adjustment is a very specific procedure we're doing. We're not adjusting bone, okay guys? We're adjusting the septum cartilage. Now, if we watch his nose, if I push from right to left side, that's okay. Agree?
Mm-hmm.
But when I push on this side, it's right there is what I feel.
Yeah, I can feel that tight as well.
Do you feel that?
Yeah.
Okay. And if we look at his nostrils from underneath, the left one is smaller than the right. So we're going to work on his left septum. This side, right side, right there on the left. This is the bone right here. This is the septum right there. Right there. The difference in this in the nose adjustment, when we're adjusting a vertebrae, this is actually really important. So when we're adjusting the vertebrae, there's bone, disc, bone. But when we're adjusting the septum, it's bone, disc or septum, and then cartilage. So we're setting this part to the bone on the top, not the bottom. That's the difference. And I need you to breathe through your mouth, please. Chin down. There you go. That's it. All right, walk off that nose job. Come on up. Walk it up. How's the walking right now, sir?
Yeah, my back feels so much looser.
A little looser?
Yeah, and doesn't feel, when I was walking it was quite sore. Just always been just a soreness all the time.
Okay.
I don't feel it when I walk to there.
Try it again, just make sure it's not a fluke.
Yeah.
Do it a couple of times. So back is less sore.
Yeah, definitely.
All right. All right. Turn the neck, move the neck around. A little different.
Still, yeah.
It's tight.
You still hear it clicking and crunching a little.
Sure, and you're gonna hear that for a minute, okay?
Yeah.
Last thing we need to do, buff and polish time. That's where we're gonna start, Ryan, okay? Our homework is very simple. You're gonna walk, like I said, 15,000 steps. I'm gonna give you a couple of things to start taking. We didn't get into your digestion.
Right.
We'll talk about it on the next visit, okay?
Yeah.
Right now, let's get moving.
Okay.
All right, and then stand up for me, please. Do you have any questions?
No.
Squeeze. Squeeze. All good, guys. Welcome to the office.